healthcare have a knack for assigning people huge roles and then, saying congratulations, go for it. So you're new to surgical services, you have a new team, maybe you know the surgeons, maybe you don't, and of course now you're going to tackle infection prevention and control in some capacity in this facility. If you're inpatient, so if you're in a hospital system, you're going to want to meet your team. Right. So you're going to want to know who those IPs are. There may be more than one. You're going to want to know who the lab directors are. You're going to also want to know who the infectious disease physicians are in that system. You want to be able to call these people when you have a question on your, in the OR and get an answer. And then you're going to want to spend some time looking at what the facility currently has in place for that infection prevention and control program. So what is already there? Did somebody do a risk assessment? Has there been a plan year over year and that plan's been updated? Get familiar with it and spend some time looking at the risk assessment and make sure you agree. And do not forget to meet and know who the facilities person is. Maybe it's an engineer. Maybe it's another nurse that has been granted the wonderful task of dealing with life safety and facilities management. But figure out who those people are. And then lastly, I would say understand whatever environment you're in, whether you're inpatient or outpatient, or even, office-based surgery, understand the regulatory compliance piece. So just pull out those regs and read them and understand what you have to have. And that's going to help you close the gap with what already might be there or what you need to do if you're the one who's going to be writing and implementing that infection prevention plan. You're going to look at three different things. You're going to pull up your state regulations, whether that's going to be hospital or ambulatory surgery center. The next set of regs, pull up your Medicare. So CMS, if you're Medicare certified, probably the case. CMS for outpatient surgery centers has various appendixes and they walk you through what the infection prevention and control requirements are. And then the last thing you're going to do is whoever your accreditation body is, do not do it alone. So surgery centers specifically, much like hospitals, are required to have a quality committee. They're required to have medical exec and boards, right? Those are going to be groups that you can use. So you're going to pull people in from your ORs, maybe OR techs. You're going to want to pull in as many folks as you can from your SPD, your sterile processing department. Whoever is doing quality for you, if that's you or you have help doing that, you're going to want to pull in those individuals. So create a team around you that can help you with those key pieces because you're really overseeing the operating room and everything that supports that. Don't try to do too much. Some of the common pitfalls with infection plans are just the lack of time to do what your plan says. So we're not going to solve all those problems. We're very targeted about what could potentially be the biggest problem and tackle those. And if I could say one thing, it'd be confident. You do know your facility and your infection prevention plan better than they do. You are the expert. They might be an expert at the regulations, but you're an expert about where you are and what you do. All of that confidence comes with being prepared and being comfortable with the material. And there's a really good tool, especially if you're in an outpatient surgery center. It's called Exhibit 351. Okay. It's a Medicare document, and it's a really nice way. This is what a surveyor is going to fill out. They literally sit down and ask you these questions. Get it ahead of time, fill it out with your team, and get people comfortable. And it will drive you. The questions will drive you to look at your policies. Nothing happens overnight, and going into a new role, whether it's a new facility or one that's been open for a while, it can be overwhelming in itself. I would set a realistic expectation, and I do this when I go into facilities, is I go, okay, what is my plan going to be for 30 days? What is my, depending on but for a new director, I would say, what is your plan going to be for the first 90 days? And be reasonable with it. Don't be crazy. So you just have to set some reasonable boundaries and guidelines and really realize you need to be an expert in the operating room and in SPD. You don't have to be an expert on everything else. And you want to treat your people well because those folks will work for you and work with you if they feel empowered and they're part of that team. And for those of us that have been in the business for a while, some of our EVS, environmental services folks, SPD folks, they don't always get treated well, and they need to be treated well. And, I think if you can, that's why I talked earlier about making them part of your quality committee, making them part of those meetings, because they bring valuable information. And if they feel valued, and they really are the experts, they are going to work for you. And I think that would be my biggest takeaway.